ACS CAN is a grassroots powerhouse that helps cancer patients.
The presence in all 50 states, all 435 congressional districts, that's truly unique.
Our approach to changing public policy is driven by our volunteers.
Because they know what cancer is, and they know what we need to do about it.
Advocacy is as important to solving the problem as is research and public health interventions.
I picked up that argument and said if we're going to be the powerful organization we need to be, we need to have the additional tools to do unlimited lobbying, to be able to be involved in the electoral process without being partisan.
I sat down with Dan Smith and other ACS staff leadership to hatch the idea of creating our own C4 organization that ultimately became the American Cancer Society Cancer Action Network.
ACS CAN fights cancer by engaging our government. And so elected officials at the federal level, state level, local level, and they have a huge role to play in the fight against cancer. Our volunteers are constituents of all of these elected officials, and that's kind of the magic in the sauce.
As an ACS CAN volunteer, it's our job to be a resource for our lawmakers and also educate them on our issues.
And to be able to tell our stories and have them listen to our stories and understand where we were coming from and make a policy change as a result of that is life-changing.
I've seen so many people get involved in the fight, and that's extremely important because we're stronger in numbers and voices. And we make a difference when we're stronger and louder.
I'm not a doctor, I'm not a researcher. I'm just an average citizen from a mid-sized town in Iowa. And I realize that my voice, along with the voice of my fellow ACS CAN volunteers, is something that I can do to move the needle in the trajectory that cancer has in our country.
One of the remarkable components of ACS CAN is that the advocacy work impacts patients and their families not by the ones and twos, but by the thousands and by the millions, and in every state.
We know what's the best policy for cancer patients, and we fight very hard for that.
Our issue transcends partisanship. I think our staff understands it, our volunteers understand it, and the most important thing is legislators understand it, and that's why we've had so much success.
The work that we did around access to care that became the ACA was incredibly impactful because we were able to really elevate the patient voice.
And I think the work we did there really made a difference to make sure that cancer patients got the kind of coverage that they needed. I was really proud to represent ACS CAN at the White House in 2009 when President Obama brought healthcare leaders together. And I think it really did signal that we had arrived as an organization.
We've had enormous impact on what we've done in cancer and tobacco control.
As a mother of teenagers, there's no issue that's more important to me than tobacco control.
When I started, only one state was smoke-free, and now we're approaching 70% of the country that's smoke-free. That is an enormous accomplishment and a huge cultural shift.
Year after year, we continue to make progress in the federal funding for cancer research because our volunteers have created a situation where legislators know that they're going to be held to account for that.
ACS CAN is helping to shape the future through helping to pass legislation, getting funds for research, which I believe will truly make a difference. It did between when my mom was diagnosed and when I was diagnosed.
We see ourselves as leading the fight to ensure that everyone has equitable access to care, as well as equitable opportunity to survive and thrive after cancer.
Everyone should be entitled to the same possibility of beating cancer, but we know that that's not the case.
We really want to make sure that no matter where you live and who you are, that you have an active opportunity and a fair opportunity to fight cancer.
I think the most important step in achieving health equity is getting a diverse group of individuals involved and using them and their voice to make the issue known.
A wonderful thing about an anniversary is that you celebrate the past, and we have 2 decades of incredible impact to celebrate, and we should. But we can't slow down.
We have to keep it up. It's too important to stop.